Welcome everyone. Welcome this afternoon to our live colorectal cancer awareness question and answer session. My name is Dr. Cynthia Harris. I'm a board certified gastroenterologist. I practice at Florida Digestive Health Specialist, specifically with Gastroenterology Associates of Sarasota. I've been here going on almost 1 year now, and today, because it is Colorectal Cancer Awareness Month, we're taking this opportunity to educate our community about colorectal cancer and what we can do to prevent it. So with that said, I'm going to field one of our first questions that we have. Please feel free to enter your question via our Facebook Live chat, and we'll be glad to try to attempt to answer those questions in this short period of time that we have today.
Thank you so much for being here, Dr. Harris. How common is colorectal cancer?
So great question. This is Mackenzie who's asking me these questions today. That's a perfect question to start this session with. Colorectal cancer is actually very common. It is the third most common cancer in our country, behind breast and lung. It is the most common GI cancer. So it's very important for us to talk about this, and although it may be a taboo subject, we really need to open up this discussion so that we can educate people more about the importance of screening and prevention, which is our primary goal today.
What are the signs and symptoms?
So there are many signs and symptoms of colorectal cancer. Unfortunately, we hope not to get there as patients, and therefore the importance of prevention. But once someone has already developed a colorectal cancer, some of the symptoms can include specifically bleeding, so blood loss that may or may not be seen by a patient. This could also be blood loss that we consider microscopic in nature, and we may not see that in the toilet bowl or with the stool. Other symptoms could be abdominal pain, bloating, or specifically change in bowel habits. And what we tell people to look for are change in the caliber or consistency of the stool. Weight loss can also be a symptom of colorectal cancer, as can low iron anemia, which would usually be picked up on basic lab work.
Who is at higher risk for colorectal cancer?
So also a great question, and certainly something we want to be aware of as patients. What are our risk factors for colorectal cancer? Unfortunately, as we age, we are at risk for most types of cancer, specifically colon cancer. Other patients that are at risk for colon cancer are those with family members that have colon cancer or colon polyps. More specifically, a first-degree family member with colorectal cancer increases our risk to the point that we would want to perform screening maybe at an earlier age. So first-degree family member would include mother, father, brother, sister, a child even. Sometimes children might get colorectal cancer. Your child might get colorectal cancer before you do. Other patients at risk for colorectal cancer are actually African Americans. We know that they have a higher risk for colorectal cancer, and in fact we generally start screening at an earlier age for that ethnic group in order to prevent that colon cancer. Other things that patients need to be aware of as far as increased risk regarding family history or personal history is inflammatory bowel disease. Crohn's colitis and ulcerative colitis increase your risk for colon cancer, and generally if you have one of those diseases, we would put you into a very aggressive screening program to prevent colon cancer, or at least catch it earlier. Regarding the risk factors that we actually have control over, because we don't have control over our genetics, but we do have control over how we treat our bodies. So a sedentary lifestyle, a diet high in red meat consumption or fat consumption and low in fiber can increase our risk for colon cancer, as can a diet low in calcium. So we really want to keep a healthy lifestyle, a healthy diet. We want to stay of normal weight also, because obesity increases our risk for most GI malignancies, especially colorectal cancer.
What kind of tests or screenings are there available for colorectal cancer?
So there's lots of tests that we can do. I'm here to talk about what I think is the best test, or in medicine what we call a gold standard, and that is colonoscopy. After I've educated people on colonoscopy, if they're still afraid to have a test like that or have concerns about the risk, there are alternatives that we can discuss. But I would really like to focus on colonoscopy because I tell all my patients it's really the only preventive tool, truly preventive tool that we have to prevent a cancer. The reason being is that colon cancer develops from overgrowth of abnormal tissue that we call polyps. Most of those polyps are precancerous in nature. If given enough time, a majority of them can become a colon cancer. So when we talk about prevention, we have to talk in terms of removing that precancerous polyp. The only way to really do that is via a colonoscopy. Now, a colonoscopy is considered an invasive procedure, but it has been deemed a very safe screening tool, and definitely the minimal risk of having that procedure the benefits far outweigh the minimal risk. So once we do a procedure like that, a colonoscopy, where a patient is sedated and very comfortable, we would be able to find those polyps because we visualize the actual lining of the colon, and we're able to remove those polyps before they become a colon cancer. Therein lies the prevention of the disease. If a patient is fearful of having that type of, quote, invasive procedure due to the risk, which do include perforation or a hole or tear, a very rare instance, then we can talk about the alternatives. And probably one of the next best alternatives is what's called a FIT test, fecal immunochemical test. And that basically picks up blood specific to the colon. So that would be a good first measure. Now you can have false negatives, meaning the test would be negative, but you could still have a polyp in the colon. And so it's not truly a preventive test. I think the best thing about FIT tests is it helps people get in the door for a potential colonoscopy that otherwise would not come if the FIT test is positive for stool. Other forms of testing that are all the rage now and very popular, especially via advertising and media, is what's known as a Cologuard test. And that is an at-home test nowadays that you can do to check your stool for abnormal DNA. Now, what I advise patients about that is, unfortunately, once you have a positive Cologuard, that implies that there is something there that's abnormal, potentially a large polyp or already colon cancer. So also not the preventive test, more of a diagnostic/screening test. Again, I don't dissuade patients from having that, especially if they have fear about a colonoscopy, but I can't emphasize enough how important it is to use the gold standard test to prevent the colon cancer, which is colonoscopy.
So, my doctor recommended I get a colonoscopy. What do I need to do to prepare, and what can I expect during the procedure?
So preparation is probably the worst part. There's no way around it, unfortunately. And basically what that means is taking a medication to clean the colon out so that the gastroenterologist can see the entire lining of the colon. It's so important. Even if you have a clear colon, the miss rate for small polyps still remains, it's not perfect, so it still remains about 5 to 10%. So small polyps being anything less than 6 millimeters. So it's very important to start with that cleansing protocol. And that can be different depending on how your doctor advises you. But certainly that's part of the preparation for the procedure. After a prep is usually done the day before, and we would limit the diet to possibly a clear liquid diet, maybe a light breakfast in the morning and then clear liquids after that. And then we would ask that you not eat or drink anything after midnight in anticipation of the procedure the next day. The procedure is very simple. The process is very simple after that. It's an outpatient procedure, and most patients could expect to take out about 2 hours of their day. They would come as an outpatient, and then the whole team would be involved in taking care of that patient. Specifically, we have a nurse anesthetist or an anesthesiologist that would administer the medication for sedation. A deep sleep would then ensue, and the procedure would be completed in about 20, maybe 25 minutes. And then the physician obviously would come and speak to you after the procedure, give you the preliminary findings. If polyps are removed at that time, they're generally sent to a pathologist. Those are reviewed, and then we would report back to the patient about the findings of that pathology. After that, screening and surveillance after an initial colonoscopy really depend on what's found, and that has to do with number of polyps, size of polyps, and type of polyps. Because there are polyps that we find that are completely benign and had no potential for colon cancer, but we might not recognize that at the time of the procedure and only know it after the pathology is reviewed.
When do I need to start getting colonoscopies? What age?
So great question. Most of the GI Society guidelines and the American Cancer Society guidelines would say that if you have none of those risk factors that I mentioned in your family before, family history of colon cancer, family history of polyps, if you yourself have never had polyps or inflammatory bowel disease, average risk screening would be to start at age 50 for most ethnicities, with the exception of African Americans, and we actually recommend earlier screening at age 45. If you do have family history of colon cancer or colon polyps, that's really a discussion that you need to have with your physician, because it depends sometimes on age of that family member and number of family members. If there's a potential hereditary disease that might increase your risk, that's another risk factor. So that would entail a discussion between the patient and the physician.
You touched on this a little bit, but if I notice blood in my stool, does that mean I have cancer?
Great question. So blood can be very alarming, obviously, and certainly important and not something that you don't want to address. Many times there are things in the anal canal or rectum that can lead to bleeding. Specifically, hemorrhoids are very common that can cause bleeding. Tears in the lining of the colon or rectum can cause bleeding. But I tell everyone, regardless of if you think it's a hemorrhoid or not, it absolutely has to be investigated. I've had many patients that think they have hemorrhoids for years, and then they come and come to find out when we scope them, we do find a malignancy or a cancer. So obviously alarming, and something not worry about, and just because you think it might be hemorrhoids doesn't mean it should not be investigated. It absolutely needs investigation.
Thank you so much. Did we have any additional questions online? Okay, thank you so much, Dr. Harris. Is there anything else you wanted to add?
Sure. So I would add that in my own practice and in the area, in the community, there are several gastroenterologists in this area. We have over 70 providers in FDHS, both male and female, and sometimes there is a preference for gender regarding choosing your physician. I would advise everyone, to really pay attention and know that this is an excellent way to prevent colon cancer as far as screening goes, having a colonoscopy. In addition, I wanted to mention that we have here at Sarasota Memorial Hospital a dedicated clinical oncology nurse navigator, Ms. Christy Stetson, and she has just informed me that there's a program here at Sarasota Memorial offering free FIT testing on a limited supply, first come, first serve. So if someone's hesitant about seeking care and following through with colonoscopy, this is an excellent first step. So I'd like to give her information, if that's okay.
Sure.
She can be reached at area code 941-917-7390. And again, that's Christy Stetson. She's our dedicated clinical oncology nurse navigator, and she can assist with that.
Thank you so much.
You're welcome.